Alrighty, it is time for our Health Watch, and as always, we are joined by our friend of the show, Dr. Syed Hussain of Trinity Health of New England. Good morning.
Morning.
So first up, we're going to talk about melatonin. There is a study that shows long-term melatonin use, may impact heart health. Some folks may use this to help them wind down at night, but what is this study revealing? Rather?
Yeah, it's an interesting study. It just is being in the process of getting reviewed and presented at the American Heart Association Annual Conference Symphony. So let's take a look at what melatonin is. So it's a naturally produced hormone in the body, especially in darkness, to promote sleep. So that the body can naturally wind down so that you can get some rest. Now, melatonin is also an over-the-counter pill that most people take for insomnia, which is either difficulty going to sleep or difficulty staying asleep, right? And so this study looked at 130,000 adults with insomnia. 65,000 of them, and followed it for 5 years, 65,000 of them took melatonin. And in that group, the ones that took melatonin, there was a higher risk of heart failure development and a higher incidence of those individuals getting hospitalized for heart failure. So now here are some of the caveats to this study, so I don't want viewers to get alarmed. This study did not have the power to say, okay, cause and effect. Can we prove cause and effect? No. It only pointed towards an association, which means more research is needed to look at long-term safety, cardiovascular safety, with melatonin use. Melatonin, like I said, has been around for a long period of time. It's been known to be safe, but there's very limited data on cardiovascular outcomes and melatonin. So we need more research.
Okay.
Bottom line.
All right. Good to know with that. All right. Up next, a U.S. study finds memory problems are happening more frequently in adults under 40. So what's the connection there?
Yeah, this is concerning. So this study looked at 4.5 million individuals who had submitted self-questionnaires related to, cognitive ability and, any memory issues, concentration issues, decision-making, all of this lumped in. And there was an uptick, actually an increase doubling seen in the 18 to 39-year age group from 2013 to 2023, so over a period of 10 years, which is very concerning. And when you sift through the data and see, okay, what are the pointers here? What are the drivers, right, in this age group in particular? Because this age group showed the largest increase in cognitive disability. It's tied to socioeconomic conditions. So social and structural factors. So those individuals making $35,000 or less in annual income. Those that have a lower educational attainment compared to the rest. So we saw more of a cognitive disability issue in this particular group. So more research is needed to understand the more minute drivers and what can we do to help these individuals out.
Yeah, that's kind of scary for folks under 40.
Now, there may be also an element of more reporting with the pandemic, mental health issues, a propensity to raise my hand and say, okay, I need help. Yeah. That may also be a driver, but that's not the sole reason.
All right. Well, thank you so much for joining us this morning. And we will catch up with the doc next week.
That's right.